It's endured one of the world's strictest lockdowns. In Lebanon, a month-long 24-hour curfew has barred most people from leaving their homes. But protests like this one near Beirut have led to a gradual easing. Now hospital staff worry the strain on resources will grow. The good news? Officials are rolling out a vaccine campaign. But critics say it's too slow and perhaps too fragile in a country where government skepticism and outright anger continue to grow. So can the vaccine turn things round for Lebanon? That's a question I'll pose to our guest from Beirut in a moment, a clinical psychologist who's grappling with the issue of whether to stay in the country or go, like many medical professionals. The way forward for Lebanon will not be easy. The country counts a significant refugee population, including large numbers of Palestinians and even more arrivals from Syria. The demographics affect how the pandemic plays out. A UN report shows the COVID mortality rate for Palestinian refugees in Lebanon is a whopping 3 times higher than other groups. Coronavirus infections continue to surge. Medical capacity is already stretched to its limits. And with the financial crisis having crushed the economy, half all citizens now live in poverty. Where to turn?
Every bed here is full. Staff working around the clock as they risk their lives to save lives. Like their patients here at Rafik Hariri University Hospital in Beirut, they too are frightened. I see my children every day, but every day I live in fear that I may transmit this virus to them. I'm trying my best to protect them. The situation has been getting worse every day.
For the last 3 weeks, our ICU beds are full, and we have about 20 patients in the emergency room waiting for an empty bed to enter. And this is very exhausting for all our staff.
For more than a month, the country has been under a 24-hour-a-day curfew to try to tackle the spread of COVID-19. But anti-lockdown protests in cities like Tripoli put pressure on the government to begin easing restrictions. And last week, ministers began relaxing some of its lockdown measures. That may help the struggling economy, but it's worrying health workers.
The number of infections in the community is still high. We have more than 20% test positivity rate. And if we prematurely open the country, that will lead to a reversal of all the gains that we have achieved up till now.
While patients here are receiving the best care available, a shortage of medicines is making the job for health professionals even tougher. The economic crisis is also forcing some to leave Lebanon altogether.
We can see the skilled health workers at all levels. They are looking forward to leave the country. I don't have exact numbers, but at least I know from 2 prestigious institutions with their total staff of 230, 300, 250 physicians, like 60 people have departed, they have left, which is a quite significant number.
In the middle of a pandemic, hospitals like this can't afford to lose a single member of staff. But with Lebanon in crisis, they may have no choice.
Brigitte Khoury is a clinical psychologist and joins us from Beirut. What's your explanation for so many doctors leaving the country?
Well, several factors, of course, have impacted decisions of these professionals, starting with the devaluation of the Lebanese pound towards the dollar. So the income that they used to make is, now peanuts. But I think the biggest decision really came after the Beirut blast in August, when it really hit security and the security of their families. And some of them, they had their clinics destroyed, the hospitals. We have several hospitals that were destroyed. Family homes. I think this is what pushed people over the edge, and then they decided to leave, unfortunately.
So it comes down to not just the financials, but also a distrust in the government, is it? Is that also where this distrust comes from as far as taking a vaccine?
This distrust is a minor word, actually, for what people feel towards the government. But yeah, it's not only a distrust, it's a sense of security. And, security is really the basis to build on a life. You need to be secure anywhere in order to be able to thrive and work and have a family and love and have relationships, etc. So when this is not present, and the Beirut blast was very difficult on people because it hit people in their comfort zones, in their homes. People were at home, people were, visiting others, people were in cafes. So it wasn't, like there was a declared war and then, shelling started. It was just out of the blues that this catastrophe happened, and it hurts many people. And when the security base is shaken, that hurts a lot. So we have many doctors who are young physicians and doctors and who were starting to establish their career who left. But we also have very well established doctors and professionals who've had a career of 30, 40 years in Lebanon who also left. So that tells you how difficult it is pretty much on everybody to be living here.
Well, tell me, if it does affect everybody, what about you? Are you going to stay? You've just told us about the financial crisis, the Beirut blast, now the coronavirus crisis.
Yeah, I mean, maybe we're giving it another year, my husband and family and I, and see where that goes. It's also very difficult to leave. You have to understand our relationship with Lebanon. The Lebanese in Lebanon, it's a love-hate relationship. We love the country. We want to be here. We want to serve it. We want to build it. But sometimes the country hasn't loved us back, and it's been very difficult. And there comes a point where you need to have you have to cut this dysfunctional relationship. Some people have done it. To me, I find it more difficult. But who knows? I hope I won't have to get to that decision. Now, in terms of the COVID, of course, the whole world is dealing with COVID-19 pandemic, but Lebanon has so many other levels of problems, starting, with the security issues, with the economic issues, with the government fallen, and then on top of this, the COVID-19. So it's been very difficult. And you mentioned the distrust about the vaccine. Well, I don't think the distrust is necessarily with the government per se, but it's more about, lack of education about what the vaccine is. And you have all these conspiracy theories, that what if they're putting a chip in us and, all these things that, are very common now. But more and more, I must say, since the first day we got the vaccination until now, the numbers have tripled and quadrupled. So it's been very good, I think.
You got yours. Could the vaccine end up being...
Yes, I got yours.
A game changer for Lebanon? Could we see
so.
the vaccine making a real difference?
I think so. If anything, on the minimal level, in terms of at least opening up the country, boosting a bit the economy, the travel of people going in and out, opening again, shops and restaurants, because we've been on a lockdown since mid-January and so many more times before. So I think that will make a difference. Yes, it will help for sure.
OK, well, fingers crossed, Baji Khoury. It's been a pleasure talking to you. Thank you very much for being on the show today.
Thank you so much for having me.
And staying in the region, and a question one of our viewers had, here's our science correspondent, Derek Williams.
Now that vaccines are beginning to be widely distributed, how long will they take to actually have an effect on societies?
We've gotten a first tantalizing answer to this key question now from Israel. At an early stage of vaccine development, its government struck collaboration deals with companies to receive vaccines quickly and at scale once they were approved. In return, it agreed to pay top dollar, but also to share subsequent data collected by Israel's extensive, highly organized public health care system. In effect, the agreements turned the entire country into a fast-track, giant-scale, real-world experiment on the dynamics of disease spread in a population during the largest vaccine campaign in history. And I'm happy to say that the results so far, which were published just a few days ago, look very good. Since the end of December, Israel has fully vaccinated close to 1 out of every 3 people in the country. So they've received both doses. The impressive numbers on efficacy from trials indicated that those people should be well protected just 2 weeks after the second shot. But that was in trials. Would that also prove true in the real world? Well, Israeli studies comparing hundreds of thousands of fully vaccinated adults to those who didn't get the vaccine have now shown over 90% effectiveness in the vaccinated group. In other words, they were many, many times less likely to develop symptomatic COVID-19, just as the trial had predicted. They were also over 90% less likely to develop severe disease, and that was regardless of age. One of the authors called the vaccines incredibly effective in real life. That's pretty much the most hopeful news I've heard so far this year.